So I want to just say a very warm welcome to you all, to this N4D and colleagues from different parts of the world side event. We're happy to see so many of you in the room at 5:30, 20 to 6. I think it's been a long day, fascinating day, but I reckon people are probably a little bit tired. So our job is to energize you and hopefully produce a very interesting 50 minutes or so. I want to also welcome anyone that's joining remotely, and I hope you're hearing and seeing reasonably well. I'm Carmel Dolan, and with my colleagues, Jeremy Shoham and Chris Leather, we are moderating this side event, and it's got quite a lengthy title. So you can see it here, Scaling Up Efforts to Sustainably Prevent Malnutrition in Protracted Crises, the Case for More and Better Financing. So it is a weighty subject matter, but nonetheless a really critical one from our perspective. In essence, what we're going to be doing in the next 50 minutes is try to convey to all of you, and I'm sure many of you are already convinced, of the need to do a better job at preventing malnutrition and do that job more effectively in the most difficult circumstances in the world, where the burden is greatest. And our challenge, I guess, is to drive up resources, especially in today's climate, but to be a lot smarter with how we deploy those resources. So that's what we're really going to focus down on for all of you here. This side event builds on a discussion paper, and that has been written in collaboration with a host of country actors from Niger, Ethiopia, Yemen, and Afghanistan. And unfortunately, our colleagues from Afghanistan and Niger aren't at this event this week for various reasons, but they have been instrumental in the content of what we're going to be discussing over the course of the next 50 minutes. To say that the discussion paper is available now on the N4D website. So it's short, by the way. So I encourage you to read it. It isn't too long. And a lot of work's gone into keeping it concise with key messages. I want to just briefly mention how we have organized, what the format is for this side event. We're super time-bound, and so we have got to be fairly structured. And first of all, we're going to start with Jeremy and myself, just for 15 minutes, posing 5 questions to Chris here, no pressure, Chris, who is going to elaborate on some of the key points from the discussion paper. We're not going to cover everything. We're just going to give you a flavor of what you can expect when you are able to read that paper. We're going to move on to a panel discussion. These 3 amazing women here are our panel, who I'll introduce shortly. And we're going to be asking them 3 related questions. And we're going to get from them perspectives from Yemen, from Ethiopia, as well as from the global level. So that's our panel. That will take now a little less than 20 minutes, I'm afraid, everybody. So we're just trying to catch up on time lost. And finally, Jeremy here is going to summarize what he's heard from the panel. And we've given a little bit of thought in N4D and with our country colleagues about how to move from N4G this week. And our next major milestone is N4G in Rwanda in November, and what we can do to make progress in that short period with the issues that we're going to be raising at this side event. I'm going to apologize here and now. There is no time for Q&A from the floor. But don't feel frustrated, because we're here all week. You can approach any one of us at any time, and we'd be very happy to get your thoughts and particularly your ideas for moving this agenda forward. To also add that some of you might have seen me wandering around today, and my colleagues with a microphone. We are supporting the N4G week by releasing a podcast from the N4D Politics of Ending malnutrition platform. So every day at 9 p.m., a podcast will pop up, and what it will do is really summarize what we've heard that's new, what we've heard that's interesting, what we've heard that's surprising, and some of your voices will be interspersed in those podcasts. We encourage you to come and find us if you'd like to be part of that process. So you've got all week to engage with us, and it would be great to talk to each and every one of you. So, enough from me. I'm going to hand over to Jeremy so that we can begin with the question and answer session. So, Jeremy, a warm welcome.
Thank you, Kamal. So, Chris,
yes.
What possessed N4G and country partners to write this paper on financing to prevent malnutrition in protracted crises?
Well, Jeremy, I think there's 4 parts to the answer to that question. There's why protracted crises, why prevention, why financing, and why us. Maybe I'll talk about the last two of those parts later. But just on the first one, why protracted crises? Just to throw some facts out into the room. So nearly a quarter of the world's population lives in regions that face protracted crises, protracted conflict, climate shocks, economic shocks, and other destabilizing factors. That's one fact. Perhaps the most striking one is that rates of stunting and wasting in these contexts are considerably higher than in more stable contexts. And just a third point, that half of all the undernourished children in the world live in contexts of protracted fragility and conflict. So clearly, if we're thinking about how we allocate scarce resources, it's definitely worth considering and putting emphasis on where the needs are the greatest. In terms of prevention, there's a slight risk here of repeating messages and facts that will be commonly quoted this week around the benefits of investing in nutrition, and particularly in prevention. I think pretty much all of us in this room recognize how malnutrition creates a vicious cycle that erodes health, it diminishes productivity, it can foster political instability. So it doesn't only threaten the lives of individuals, but it's not too much of a stretch to say that it can contribute to insecurity, political instability, not only in the countries affected, but also through multiplier effects within regions and even globally. Another fact that I think we all know, that nearly half of all deaths of children under the age of 5 have a strong relationship or are attributable to undernutrition. But I think if we relate that fact to another fact that has been shown through various studies, that the number of children dying before their 5th birthday is strongly associated with the risk of state collapse. And that's quoting from a couple of studies. We can provide the references. So that illustrates the strong link between high rates of child mortality as a result of malnutrition and then political instability and the risk of state collapse. So strong arguments there, but of course there's the economic argument as well that was strongly highlighted by the World Bank investment framework coming out at the end of last year. And that now often quoted fact of if you invest $1, then that can give an amazing return on that investment of $23. Now, of course, in protracted crisis situations, we might not be looking at that same rate of return, but even so, I think the evidence shows that investments of nutrition, even in the most fragile of contexts, can still give a significant economic return for local economies. So I think that's half of the answer to your question.
Chris, I'm going to just ask you then, what do we mean when we talk about more and better financing? What does that look like in protracted crises? And is that particularly different to thinking about more stable contexts?
So in the paper, we highlight how many of the approaches that are needed are indeed similar to more stable contexts. I think we're still talking about a multi-sectoral approach to nutrition. But if we're thinking about the financing, then we are talking about a need for a fundamental shift towards more strategic multi-sectoral financing in protracted crisis situations. Clearly, as we will see, the majority of aid going to protracted crisis contexts is humanitarian assistance, and of course that is critically important. But it's widely recognized that we need to be going beyond that, and indeed we are going beyond the treatment of malnutrition in many contexts towards a much more holistic approach that addresses the root causes and also does that through stronger local and national systems and capacities. So we're talking about operationalizing a humanitarian development peace nexus approach, if we want to use that kind of terminology, but we're talking about that holistic approach. And I think for us and for country partners, a critical aspect of that approach is that we need to see greater convergence of humanitarian development and peace actions on the same at-risk populations. So perhaps there's a tendency at the moment, because of a lack of coordination and coherence in the system, you might get humanitarian assistance targeting some populations, but they're not the ones receiving the more developmental assistance. Just in terms of the characteristics of more and better financing, again, often quoted rhetoric about longer-term, flexible, predictable financing, the need for financing to be aligned with country-led priorities. But I think these are all kind of terms and ideas that we're all very familiar with. I think the next question is, why is that not happening on the scale that it needs to happen?
Well, actually, the next question, Chris, is given that we know all this about what better financing looks like, what kind of progress have we made?
Well, I think there's some good news, and it's always good to start with the positives. But just to emphasize again that the kind of approaches that I was describing, the longer-term, multi-sectoral, converging approaches, all of those things have been stated and agreed to on numerous occasions through numerous international commitments and guidelines. So, for example, the New Deal for Engagement in Fragile States, the Grand Bargain, New Ways of Working, the OECD DAC recommendation on nexus approaches. It's all been said multiple times before. So what progress have we made against those commitments, coming to your question? The good news is that there are numerous examples of where that has been implemented. And in the paper, we highlight some examples of policies and programs that are promoting that kind of nexus approach to nutrition. So again, the good news is that success is possible. But then the bad news, it isn't happening on the scale and with the consistency that it needs to happen. So this year's States of Fragility report by the OECD clearly highlights how aid to protracted crisis contexts continues to be dominated by humanitarian assistance, and where there is significant levels of more development aid, the integration between humanitarian and development response isn't there. There's very little of that convergence that I was talking about earlier. One more fact on localization, another big commitment that was made during the Grand Bargain. In 2022, out of the $47 billion allocated for humanitarian assistance, only 1% of that was channeled directly to local and national actors. A longer a long way from the 25% commitment made during the grand bargain. So some progress, lots of reasons to be hopeful and optimistic, but we're falling a long way short compared to the rhetoric.
Okay, so without beating around the bush, Chris, why isn't more being done? And maybe because in the shortness of time, I'd love to spend more time on this topic with you. What would you say might be two of the key obstacles underpinning this lack of progress?
So, two obstacles, but first I just wanted to highlight, because all of this has been said so many times before, we didn't want to just regurgitate in the paper what has been said in so many different ways in all of these international conferences. Hopefully, the key added value of the paper is that we try and look at what are the obstacles to more and better financing in these contexts, and how can they be overcome? We're not saying that we fully understand all the issues and that we have all the answers, by no means, but we'd quite like to stimulate debate within the nutrition community and beyond to have more open and honest discussion about what is holding us back. So what are some of those obstacles that we identified? Well, first, often there is a lack of awareness amongst policymakers, decision makers, about the feasibility, those success stories that could be built upon. That's one issue. And also, despite a lot of the good advocacy that we do, still a lack of awareness about the benefits that investing in nutrition can bring, even in these most difficult of circumstances. Maybe just one other obstacle. I know we're short on time. But the humanitarian imperative, of course, and quite rightly, makes us think and focus about saving lives and meeting immediate needs. And that's entirely appropriate and understanding. But it does often mean that there are entrenched practices and ways of working that get put into operation at the beginning of a crisis, and that crisis becomes protracted. And those ways of working continue. So I think it's often difficult to step back from that and think about what is feasible and what's possible that could help us operationalize approaches that focus more on prevention.
Great, Chris. So just to get the conversation back on a more positive note, what are the solutions to overcoming these obstacles? Maybe just a few that spring to mind.
Yeah, so in the paper, we categorize possible ways forward under three headings. The first one is about the money. We would love to be saying more money, and maybe there are opportunities for that. But I think we're placing the emphasis on better use of money. We're placing emphasis on diversification of funding sources. Clearly right now, and possibly into the future, we can't be depending as much as we did in the past on traditional ODA. So we have to be looking at some of the other more, if you like, innovative sources of financing that we talk about for all contexts, and which ones might be appropriate for protracted crisis situations. But it's not just about the amount of money, it's about the strategic choices we make around how we allocate funds against what priorities. And clearly, we are making the case here that in constrained resource environment with development aid, humanitarian aid in decline, perhaps there is a strong case for focusing on the more protracted crisis contexts, not only because of the needs in those contexts, but also because of the multiplier effects regionally and globally if we don't focus on those contexts. So that's about the money, but then there's also the perceived and actual risks around investing in highly fragile and conflict-affected situations. And we have to be honest about those. I think from our engagement and work with country partners, there are clearly real, actual risks in these contexts that are associated with weaker governance, concerns around the political manipulation of aid for political purposes, all real and important risks. But we also see where some of the risk is perceived. It doesn't reflect the actual reality on the ground. And maybe that's sometimes because we don't do a sufficiently nuanced analysis. Quite often what is done at a country level can be determined in donor capitals without the detailed, if you like, political economy analysis that is needed to, if we're wanting to work more and support local and national actors, we need to have the analysis to understand the roles, the interests, the motivations of different actors, to be able to understand who we can work with and who we can support from an international perspective. Just one other point on mitigating risks, I think. Maybe Karima and others will pick up on this point, but let's phrase it as a question. Do we distinguish adequately between political levels of engagement and more technical levels of engagement? Carmel and Jeremy were recently in Niger, and I think you found the approach of Switzerland, SDC, interesting, and the way that they have a more nuanced approach to that. So they are still committed to working with line ministries and supporting the maintenance and strengthening of local and national service delivery capacities, whilst they still manage and adjust the political level of engagement, if you like, with the political authorities in the country. So distinguishing better and more clearly between the political and technical levels of engagement is something I know as well, Karima, you have spoken about quite a lot. Just the final area that we talk about in the paper in terms of ways forward is around building alliances. Clearly, these obstacles are not ones that are just faced by the nutrition community. That these kinds of obstacles affect everybody across the board. So kind of building the alliances beyond the nutrition community with those working in health and social protection and agriculture, and indeed the humanitarian community, about how we overcome some of these issues. We need to be doing that as a nutrition community. And the final point, I think, is because often there is a lack of awareness about what is possible and the benefits of investing in preventing malnutrition in the more fragile context. There's that lack of awareness. Can we be doing more to raise awareness within donor countries about the benefits? It's clearly the importance of support for the countries affected, but this can actually benefit everybody. It's in everybody's interest to focus on this issue in these contexts. Thanks.
Thanks, Chris. And you've really managed to convey a lot in a very short period, and I hope the audience is hearing that clearly, and a strong encouragement to pick up this short document and read more about these three areas that Chris has just alluded to. I want us to move quickly on to our lovely panel and welcome each one of you. I want to start with welcoming you, Karima El-Haddar. I think many of you will know Karima in the room, who is from the Scaling Up Nutrition Secretariat, which is located in the Ministry of Planning and International Cooperation in Yemen. Warm welcome, Karima. Next to Karima is Abigail Perry, sorry, I thought we were, who has recently, many of you will know Abby, taken up position as chief of the nutrition division of the World Bank. So we're getting a donor perspective as well here. Warm welcome, Abby. It's great to be with you again. And finally, to warmly welcome Hiwat Darsin, who I've only just met today, and it's such a pleasure to meet you, who is the lead of the Nutrition Coordination Office in the Ministry of Health, Ethiopia. So what we're going to do, as I mentioned with our lovely panelists, is we're going to ask 3 questions They're only going to get 2 minutes. Earlier I said, oh, you'll have 3 minutes at least, but now I'm taking that down to 2. We're going to ask each one of them the same question, so we're going to go through a process. And as I said, Jeremy will helpfully summarize all of that. So I'm sorry to shorten the time that you have, but I know you're all super skilled on panels. So I'd like to start by handing over to Jeremy, who I think is going to pose the first question.
Okay, it's going to be you, Karima. Great. So this is a question almost like the one that I asked Chris about obstacles to making progress in tackling malnutrition in protracted crises. What are those obstacles that you see?
Yeah, thank you so much for having me and representing Yemen here at this very difficult time of the fund cuts everywhere. So the obstacles as part of this paper, everything Chris said applies to the context in Yemen. However, I can just summarize based on our experience is really looking at nutrition from the angle of humanitarian is damaging the whole thing about nutrition, because it is very important, it is humanitarian, treatment is part of that, but treatment alone, and this is what our partners in country are saying, treatment alone will not work. And they can't, even humanitarian actors, they really couldn't do any breakthrough or improving the situation. It is deteriorating. Why? Because prevention is very important. And allow me to reflect on what I have heard since this morning. So, and to, try to explain maybe a little bit differently the terminologies. So I heard the prevention since morning several times. This is very excellent. But from my point of view, prevention is not within only the health sector, is not only within the social protection, but also we need to bring in all the other sectors, the agriculture, the education, the fisheries and livelihoods. And this takes me to the other point, that nutrition is development. Yes, I have heard this. I was very glad since the morning everyone is emphasizing on this. However, development means the development structures. So if we are going to tackle the issue of the malnutrition, we need also to look at the development structure and the, it is always perceived, the development as a luxury, as a thought after thing. While development in its nature is looking at the vulnerability in the country, right? And we are always focusing on these vulnerable issues. If we have malnutrition, so this will be the priority for the development plan. That's why I think one of the obstacles is not looking at malnutrition as part of the wider development plans in the country.
Hewat, yes. Please, same question.
Okay, greetings everyone. It's a pleasure to be here and to share the context of Ethiopia. So as we all agree that malnutrition in any of the scenario, be it in development or in the crisis on the humanitarian aspect, it is like demonstrated in 3 level of cause of malnutrition. So in terms of the humanitarian setup, it will be in highest attention that the causes are highly addressed in equivalent or in a coordinated way. One is the food insecurity. So the food insecurity is due to the displacement of the population. So the productivity will be low, and in turn the most vulnerables like the children, the younger children, and pregnant and lactating mothers are more affected. The second one is due to this climate change, the frequent happening of drought, floods, and so on will be affect the productivity in terms of production, availability. The third one is disruption of basic services such as the health service and the water and hygiene access, which are highly linked with malnutrition or infection. So the vicious cycle of malnutrition and infection are the more obstacles. The fourth factor is, even though the funding or the attention to humanitarian setup is a little bit high, as demonstrated by Sir Chris previously, but in my view, those funding opportunities are, one is not in need-based, the other one is fragmented, or it is not coordinated in such a way that answer the immediate humanitarian setting, and it has to be linked with development, because those communities should be graduated from that situation after a brief time, but it is facilitated, or it has to be facilitated, the development process, or which is more resilient for future shocks, one. The other one is to graduate immediately from that situation, and those communities should be productive in turn. In most of the cases, that is not the case. There are fundings and expanding in very brief and very uncoordinated and very not cost-effective ways. So that is the problem for protracted crisis and in turn mismanagement of the fundings.
Right, thank you, Hewitt. And Abby, how about you? Obstacles to making progress around malnutrition in protracted crises?
Thank you for inviting me to join this panel. I wanted to because I've been thinking about this topic and talking about this topic for quite a significant part of my career from different angles. So the first thing that always comes centrally in my mind is this challenge about when you're trying to do things differently with money, the issue of needing to show results in order to give the confidence that you can use money differently and get an impact. And although I think sometimes it's quite hard to kind of talk about, concretely the impact of humanitarian funding, because often the counterfactual is pretty tricky to understand. In reality, every single time I've been involved in something where we've tried to look at doing things differently, the issue of, but can you achieve a result, comes to the surface. And that result is obviously quite hard because we've got the issue of the fact that you're operating in often incredibly fragile systems. And fragile contexts. The resources are never sufficient. The levels of pressure and the causes of malnutrition are so complex that demonstrating results and giving people confidence, whether it's a government, whether it's a donor, that you can actually achieve something different as a result, I think is a particularly challenging issue. The second one is I do think that we still have a problem that not enough humanitarian thinkers think development, and not enough development thinkers think humanitarian. And what I mean by that is understanding how, from a humanitarian perspective, the priority might be around system strengthening, what that looks like and really involves. And on the development side, understanding how shocks, crises, stresses influence the outcome we care about, and how you can factor that into the way you look at designing development investments. That's still not, we've seen progress in areas like social protection and shock responsive social protection, but it's still not an angle that we think about enough, and I don't hear enough development specialists thinking about that concept. The final one I want to note is can sound like a very minor one, but I think it's a really fundamental one, and it's to do with the administrative effort required to do things differently, and the fact that we're dealing often with very under-resourced systems, be it on the government side, or indeed, honestly, on donor side as well. So administering resources through a more development framing can often put quite a lot of pressure in terms of the ability to kind of manage the money, show the results, think about the accountability, And it might seem like a very minor thing, but in my experience, it actually becomes quite an important impediment to actually trying to use money differently at whatever level in order to address this issue differently.
Thank you. Great. Thanks to you all. So you've highlighted some of the challenges as you see them. How do you think some of those challenges that you've highlighted could be overcome? And a second part to the question, which we often neglect, is where do the responsibilities lie to take those solutions forward? So what do you see as some of the solutions, and who do you see as having capacity and responsibility to take those forward? Let's go in the same order again. Karima first.
Yeah, thank you so much. So this is the opposite of my first, question. So I think we need the humanitarian and development structures inside the country to work together. And this means that it doesn't mean that they will work in separate, but they need to implement one joint plan. And they need to converge on one, affected community. This needs to be hand in hand, completing each other. And this takes me to the second part, which is we need also to have joint funding for malnutrition. I mean, we have a lot of donors here and there. Each one is supporting something. So if we have a joint nutrition plan, also we need a joint financing mechanism. I think this is one of the shortest way, I believe, to resolving the issue of the silos inside the country, no matter how they tried. Without joint plan, joint finance mechanism, this will be difficult. And this is the nexus, in another word. What was your second question?
Where the responsibilities lie for making those things happen.
Yeah.
Who can make them happen?
Yeah, they share the government, and also the donors share the responsibility. However, to be honest, in this context, governments always have their own challenges that most of the time they are out of hands. Let's be, frank. And so we believe that the donors, they can always, work with the government, support the government. Donors need not to avoid the weaknesses, and they need to look at these weaknesses within the government structure and support them and enable them. So sometimes from Yemen examples, at the subnational level, the government institutions are very strong, but they are not enabled. While on the national level, they have so many weaknesses, aspects, but they are not empowered. So that's why I differentiate between enabling and empowering the government to do its job. It is its responsibility. Of course, this responsibility then, not at the same time, but then can be shared with the CSOs and the others. Thank you.
Okay, thank you for the second question. So the way to addressing malnutrition should be like the responsibility of key stakeholders. So those key stakeholders has to be clear partnership or clear stakes at each of the points, and it has to be attached with accountability mechanism. For in case of humanitarian setup, for addressing the root cause of malnutrition, such as the root source of the crisis or any sort of humanitarian setup, it has to be addressed. So in my view, the malnutrition is the source of all things, because it imposes poverty, it imposes inconvenience, instability, and so on. So it has to be addressed, the root cause of the cause of that conflict or that scenario, one. The second one is it has to be linked with, for example, if we take agriculture and climate, it has to be designed in such intervention for climate resilient, smart interventions has to be in place, so it will reduce the cause of malnutrition or being obstacled. The other one is it has to be linked with early warning and anticipation of those crises and pre-planned, and also the response has to be based on the priority, and it has to be linked with developmental tasks that for the future, for resilience and shock resistant community. So those things has to be in line with, and it will be designed for those the future crisis, or to get rid of at least in short time from that crisis. So I have to emphasize on the addressing the basis causes and linked the humanitarian and the peace and triple nexus for addressing that challenge. Yeah.
Overcoming obstacles. I think the first thing I do want to note on this topic is that it's important, I think, to recognize there's a huge heterogeneity in the concept of fragility. So I think the first thing is just to make sure that we're actually unpacking the kind of different contexts where we're talking about this being a challenge, and recognizing that in more extreme settings, these solutions in front of us may need to look quite different. Linked to that, I think the second part is starting to work out kind of playbooks depending on those different contexts. And what I mean by that is trying to look at how concretely we can show you can move from where we're at to the better situation with some very concrete ways of kind of plugging in the things that we need to see happen quite in as simple a way as possible into more development type investments. I think where you've got either, kind of challenging conceptually around understanding how fragility affects malnutrition, or indeed just frankly very, very busy people who are challenged with actually trying to develop, be it within governments, be it with partners, trying to develop large-scale development projects. We need to make it easy as possible to plug in the kind of ways of looking at how we deal with fragility and malnutrition in a more straightforward manner. It's not a simple thing to do, but I think we're often stuck at the point of saying, this is a problem, we need to do it differently, and here's some very broad ways that we need to think about it differently. And that is almost impossible for people to then take and start to apply very concretely into what really is going to matter differently, which is project design, development, policy and program design and development. So I think we need to work on that. The final thing also, I think it's always incredibly important to have voices like Karima's and Hiwat's on the stage, because ultimately they're also reflecting a really important principle, which has been about trying to have confidence in supporting governments to take leadership and have the capacity to do that. And I think, SUN has been such an important initiative in trying to actually enable governments to have access to expertise that allows them to move their agenda forward in the way that they need to. And we can't lose that. I think there's a risk there in terms of inadvertently taking the kind of power and capacity and empowerment out of the hands of government, when actually we have to do exactly the opposite of putting the power back into the hands of government. Notwithstanding the humanitarian imperative, but nonetheless, we need to really focus on that.
You all. I'm just going to have to say, there is a third question that we just wanted to touch on you with, but I'm going to shorten it because we have literally got 7 minutes and they're already hovering to boot us off the stage here. I totally respect time, by the way. So I want to let Jeremy do the little wrap up. So what I'm going to do is just ask you in 30 seconds, okay, Karima, this is your challenge, to say, what one example of success do you want to share from Yemen relating to what we've been discussing today. So just very briefly.
Yes.
Thank you.
I think it is the role of the Sun Yemen Secretariat in convening all the sectors, updating the MSNAP together, very participatory process. And after developing the CRF, the Common Result Framework, we have developed the implementation and financing modalities, the monitoring and evaluation. So I think this package as a whole is the success that we are looking for. We really need now the support of our partners from the donors, the UN agencies, and the international organizations. And also, this plan is backed by the ownership of the government, all the sectors. We have developed a very huge and beautiful governance structure from the national and subnational.
Oh, that's great. And I agree, it really is amazing what you've done and achieved just in the last year and a half, 2 years. Amazing to see. Hiwot, I'm going to come to you next. Please keep it very brief, 30 seconds. What do you want to say about one success in Ethiopia?
Okay, I can mention few, but I will be specific to this. The first thing is the coordination, governance, and leadership from the national highest level of leadership to the lowest level at the community level, which is coordinating health and other agriculture and other ministries which are pertinent stake on the food and around food and nutrition. That one is one. So in terms of as an extension or as part of the key priorities during that coordination platform, like making stunting zero by 2030 in which is the Sakota Declaration. So one is that one. The second one is as a learning, we learn that to have this humanitarian peace triple nexus. So we develop roadmap as a country and implementation guide, and we are implementing in five regions, and a lot of learnings has awaiting us to share for other member states. The other one is since a lot of protracted crisis in Ethiopia, so we learn to address all those challenges by local and context in sustainable manner. So so-called Hawassa Declaration, which is a declaration which is aimed mainly on to have self-contained type or not aid-dependent type of graduating or addressing the humanitarian setup by the government's own or the locality's own system. Thank you.
Thank you, Hiwot. Sorry to be rushing you guys because you've got so many rich. Abby, so give me one example of, it's probably a bit early to say from your World Bank experience, but wider change that you've seen on your amazing journey as a nutritionist over all these years. What would you pull out?
I'm very distracted by the fact I think we do need to get off this stage.
We do need 5
No, I do feel that there has been a very noticeable and important shift in recognizing that we can't neglect or kind of annex the fragile context as being, a humanitarian problem. I think that has meaningfully moved. We have better evidence, a better ability to talk about that. So I think we've kind of created a very fertile ground, and I agree with Chris. What we haven't done yet is work out how to overcome the really sticky issues, and I think that's where we need to focus our effort. But I do feel that things have at least shifted compared to when we started some of these conversations a long time ago. So that does give me hope and potential. I even hear it talked about a lot within the walls of the World Bank. So this is a very positive.
Well, that's very encouraging. We'll come back to you on that. Okay, everyone's hovering, but I just want to give Jeremy, because he's been busy writing here, 1 minute. He did have 5 minutes originally. Jeremy, you've got 1 minute to showcase how good you are at synthesizing.
Great, thanks a lot, Kamal. So we heard about a large number of obstacles, many of which have been already discussed. Too much framing of nutrition as a humanitarian problem in protracted crises, prevention only possible if all sectors are involved, fragmentation due to climate change, displacement, etc., etc. Actually, one thing that Abby said, which I really liked, among many things, was humanitarians don't do development very well and vice versa. Also, the administrative challenges, I think, are huge for the different way of working that we all want to see. On the solution side, well, as Chris said earlier, we know a lot around a nexus approach and localization, early warning, risk mitigation that Hewitt talked about. Abby made a really interesting point, I thought, about successful government programs and enabling those programs, making it easier to piggyback onto those programs and to strengthen them in any way possible. And of course, we heard about the successful advances going on in Yemen and Ethiopia at the moment. So lots of light on the horizon and a real sense that progress is happening, but not fast enough. So where we are going to go from here for Nutrition Works is this paper that Chris, N4D, God, that was a terrible mistake. I used to work for Nutrition Works, so sorry about that. Where we're going to go from here is we're going to continue working on this finance paper that Chris presented earlier. We're going to work with a number of countries and hopefully nuancing the messaging, getting more detail in as well. And also we'll be making linkages with others from other sectors in the nutrition, as well as the nutrition community, who are interested in addressing the same issues and perhaps work towards making this particular subject something we can bring to the Sun Global Gathering in November at the end of the year.
Okay, well done, Jeremy. That wasn't easy. Okay, that's the wrap. And I'm looking at Ashan here because we are, in our minds, thinking about moving from here this week towards the gathering in November, and there's a lot to achieve. So I leave you with three things. Think about prevention first as the priority in protracted crisis context, and let's be smarter about how we deploy our resources. We would like more resources, but right now, today, I think we're all aware, this is looking very unlikely, so we have to get much, much smarter about what we're doing. Thank you all very much. I don't think we've overrun, and we've even managed to do this whole thing in less than an hour. So, all the best to all of you. Thank you very much.